The latest report to be produced from the BMA's Board of Science is Drugs of Dependence, the Role of Medical Professionals. And with me today to discuss this report is Professor Avril Mansfield, who's Chair of the BMA's Board of Science. If I could just start by asking you why the BMA has produced this report.
Well, you'll be aware of the fact that there is quite a lively debate going on at the present time about drugs of addiction. And to some extent we feel that the medical aspects of that have been rather neglected. And we are obviously quite clear about the fact that one has to be tough on the criminal aspects of it, but we would also like people to remember that drug addicts are patients, and we as doctors have to care for these patients who have a drug addiction, and we need the knowledge in order to do so.
So what is the BMA trying to achieve with the publication of Drugs of Dependence, the Role of Medical Professionals?
It would like to put into the public area the fact that we have a concern about the way in which the debate is going. We would like to be central to that debate when the opportunity arises, and we particularly want to have that based on good factual evidence. We've been helped by a team of experts who have given their time, and we have, I think, a very useful resource for doctors and others to refer to.
Sure, many doctors will have expertise in treating patients who use illegal drugs. How can they contribute to the BMA's work on drugs of dependence?
They're very important because they can feed back to us some of the practical things that they have discovered and possibly some of the things that they disagree with in the report as we have written it. So we'd like to hear from doctors. We also want them to feel enabled to participate in the debate, perhaps locally, perhaps nationally, when the opportunity arises.
You can download a copy of the report from the BMA website. Alternatively, print copies of the report are also available.